And Google Meets wants to show notifications. Okay. Okay, there we go. I'm just going to plug this in. I need to open another screen just in case I get any urgent messages. Okay, I think we're ready to go.
Okay, so this is the ClaimMD homepage. Our system is web-based where you can use this from any computer. The best browser to use is Google Chrome or Safari. Now, in taking a look at our system and using it in conjunction with OpenEMR, OpenEMR has the ability to create a claim file. With our system, you can take that file it creates, you click on Upload Files, find that file on your computer, and then upload it accordingly.
Can we upload it from our end? In other words, we have the ability to transmit in batches.
Absolutely. So if you wanted to send the data over through either SFTP or API, you absolutely could.
Okay.
And if you would like to send that over via API, I can send you that information once we're done with this demo.
Okay.
Okay.
So what we
great.
So what we have is a network, and a network we're looking to grow, and we want to make sure that when we sign up with a clearinghouse that we can grow in that direction. So if you can imagine for a moment, we have in OpenEMR we have one code base and one database, but we have satellite, I guess you could call clinics or groups, and there are two ways this can work. That people in a group may want to upload their files individually, which I assume may be through their rendering or through their NPI, their rendering NPI or their EIN, and that some will be potentially wanting to be engaged in contracts in which with health plans, or they have contracts with health plans, or we have contracts with health plans, where we would be uploading claims for the entire network and managing those centrally. So does that give you an idea of what we're exploring here?
Yes.
Okay. I thought it would.
Yes. So we'll be able to handle it either way you decide to do it. Okay.
What if
you can send them over. Go ahead.
What if we want to do them both ways?
You absolutely, again, you can handle, if you want to manually upload them, you can. If you want to send them over through SFTP, you can. If you want to do an API, you can. But you can do all three at the same time. We're a pretty flexible software vendor. Okay, we are a back-end engine for probably about 200 different softwares.
I know. I saw
Okay,
that.
so we connect a lot of different ways.
Yeah.
So we can handle however you want to deliver the data to us. We can handle it, and we can do it multiple ways for you. Okay.
So if we do contracts, this is something we've never done before. There's some other folks we'll be chatting with, but right now we're just gathering some information about you folks because of all that's going on in the, I guess all the things that are kind of going on in the world between Medicare, Medicaid. Certain health plans are using only certain clearinghouses, and others are varying their fees depending on whether you're doing more than 50% of non-par and things like that. So it's kind of chaotic out there to figure out where's a stable solution long run. Because so anyway, yes. So if we are, when I look at your pricing, it isn't clear about what's the difference between the three different levels. The highest level seems to indicate, well, it doesn't really, it indicates, it's very open, it's very unclear to me what it means. When it
Okay.
says, more than, 100 people, or, unlimited claims. Now you're kind of showing me. All right. So is that unlimited for what? Is that unlimited per provider, or is that unlimited
Okay.
for?
Let's talk about the pricing. Okay. So if we're talking about my unlimited plan, it's $100 a month. Unlimited claims means unlimited. You can submit as many claims as you want. Okay. As I make my way through, hopefully it'll paint the full picture for you. Okay. Unlimited ERAs. You can receive back as many ERAs as you want. You'll receive 1,000 eligibility transactions, so you can verify patient benefits 1,000 times. Anything over that 1,000 will be either 2 cents or 10 cents, depending on the payer.
Okay.
We try to be transparent with our pricing. If you click 2 cents on our website, you'll see the payers that are 2. You click 10, you'll see the payers that are 10. There's no setup fee with this particular package. For per billing provider tax ID, if you're billing for multiple tax IDs, there's a $25 charge per additional tax ID after the first one. So if you have 10 tax IDs you're billing for in your business, you'll pay for 9 of them. Okay. The next thing says per provider. You can have as many providers on here. We do not charge per provider. So if you had 150, 200 providers on one account, we don't charge per provider. We don't charge per NPI. We charge per tax ID. Does that help paint that picture for you?
Yes, it does.
Okay.
It also, when you please continue, but one of the things I want to also get at, and this is new for us. We've been talking with some people who, well, I guess they're accountants for medical. But what we're also needing to do, of course, is that if we get a lump sum payment for one tax ID and one organizational, I guess not an organizational NPI, but if the contract is through our not-for-profit, in which other people are contracted with us, we need to be able to pay them, right?
Right.
So that's new to us, and we're wondering if you can help out, or at least what's the data format, so that we can sort through that, or at least make sure we have that functionality will work with your system. I hope I'm making
Okay.
sense here.
Okay, so you want to be able to split up. So when you get payments, let me just make sure I understand what you're saying. When you get the payments, you want to be able to split them out by, if you need to, by NPI. So in that way, if somebody outside the network or somebody needs to be paid, you can pay them accordingly. Is that correct in what you're saying?
It would be someone in the network, right?
Somewhere in the network, yeah. Okay. So when I talk about the ERAs in a couple minutes, and hopefully we'll have time to get there. But yes, we will split out every single electronic remit. Now, we don't touch the money, we just get the receipts. We'll be able to split out those receipts for you. So in that way, you know what NPIs received what type of payments. And I'll show you that. We may get to it today because I know you're kind of pressed for time. But if we can, I'll show you that in the ERAs.
Well,
That's the 835 file that we provide back that you will actually be able to upload into OpenEMR. And then that would be able to post there for you as well. But we also provide that same file in the CSV format. So if you had another system you were doing to be able to help manage that, if you can give me a little, hopefully we can get there today. Hopefully we have enough time to get there today. So as we go through the pricing, let me just finish up with this really quickly. These 3 lines talk about the claim formats that we can accept. Okay. OpenEMR gives us that first one, so there's no issue there. Electronic appeals, this is a feature that's coming soon, and I'll show you a little bit about that during this demo. And then this last line talks about paper and fax claim/appeals. If there's a payer that we don't have electronic claim submission for, nor electronic appeal submission for, we're going to flag that claim and let you know. And then we're going to give you the option to either print it yourself or have ClaimMD print it for you. If you'd like for us to print it for you, we can. It's $1. That includes up to 10 pages. Each page after that's 10 cents each. If you'd like to print it yourself, you have that capability to do so. For us to do something, for us to print it off, you'll have to actually go into the claim and type in the word paper. So it's not a situation where we're going to send off paper claims for you and you will never know. There's something you'll manually have to do to be able to send off a paper claim. We try not to nickel and dime our clients, okay? You'll know when you're being charged. So that's everything with my pricing. Training's included, customer service is included. We don't do any long-term contracts. So I wanted to touch on those.
Great.
Now let's jump back into the system. So I want to try to answer that question for you about how we split out that data on the back end. Okay. So once we get so now I'm jumping back in here. We're talking about how claims get into our system, and we've kind of talked about the different ways we can grab that data. Okay. Either by upload or a manual upload, or you can send that data over to us. Once we get it, the first thing we're going to do is scrub the claims to look for any issues, omissions, and alerts in the claims. Once they're scrubbed, we're going to place them into one of two buckets, either into the rejected claim bucket or the pending approval bucket. The rejected claim bucket are claims that have issues that need to be fixed. Now, I like to always tell my clients the turnaround time for claim scrubbing. It takes about 1 minute to scrub 1,000 claims. So it's not a long period of time. So if you upload a batch of 1,000 claims, it takes about a minute to scrub all those. So it's not a long period of time. You'll be waiting hours or anything like that. You'll be waiting.
So you're scrubbing.
minutes.
So you're making sure the claims the fields are filled out, and at least the codes are within understandable.
That is absolutely correct. Let's go ahead and I'm gonna pull up a rejected claim. I'm gonna pull up one of these really quick. I'm gonna pull up two. We'll start with this first one for this patient named Sylvia. Now, when you look at the claim in our system, we give it a similar layout of the CMS 1500 claim form. If you're doing any UB04s, we make them look like those as well. So as you're taking a look, you'll see patient demographics near the top, diagnosis code, procedure codes, provider information at the bottom. So your end users, it gives a similar layout of that claim form. Anywhere that there's any issue on the claim, we're going to highlight that for you. If you take your mouse over what's highlighted, our system's going to tell you what the issue is. If you click in the box to correct it, we give you common corrections for what you've typed in. So for this one, it looks like it's missing the encounter, either the XA, XD, or XS. I'm going to select one of these just so we can move forward. I'll click Save Claim. It scrubs the claim to look for any additional issues. If any issues are found, our system will tell us. If not, you'll see the Claim Valid box. And that box says no errors detected. The claim is in a hold status until transmit is approved. We can now go to the next claim. And I'm actually going to skip past this next claim. We're going to take a look at this last one. Now, this last claim is a workers' comp. Now, in your group, are you doing any type of workers' comp claims? I assuming behavioral health, you're not doing much, if any.
Some, but not many.
So, okay, all right. With our system, you have the ability to send these claims off as well. They will always be flagged as rejections because these type of claims always need some type of additional information, be it medical records, notes, something else has to go along with these claims. With our system, as long as the payer accepts electronic documentation, you'll be able to attach that documentation to the claim form. Come here to attach documents. You can find the file on the computer, and you can attach it accordingly. Once the file is attached, and you can attach up to 10 documents to a claim, you can label them according to the HIPAA guidelines. The most common labels support data for claim. All right, but if this is any type of medical record attachment, there's a wide variety of HIPAA approved labels. I'm going to select one just so we can move forward. Chemical analysis. I'll click Save Claim. Scrubs it, looks for any additional issues. Then your file system will tell us. If not, see the Claim Valid box. I go back to my Manage Claims screen. Now you'll see we have 54 claims ready to go over to the payers. Now with our system, I'm going to click Approve Transmit to send those off. Now, for our clients who upload claims, you'll see that Approve Transmit all the time. Now, we have clients who automatically send us the claims. For those clients, and so this may be up to you how you handle this. For those clients, we normally will scrub them automatically, and the ones that are ready to go, we'll go ahead and shoot those off. The only thing that you'll see here on this screen are the rejected claims. So in your situation where you're doing both of those options, that's totally up to you how you handle that. A lot of times, if a client's doing multiple options, they will turn that Approve Transmit option off. So in that way, once we get the claims, the ones that are ready to go, we'll automatically shoot those over to the payers. So far I've talked about how the claims get into the system, how we scrub them, and how they get out. Before we talk about the different things that come back from the payers, any questions so far?
No, and I just got an alert that said I have some extra time, so
Okay.
you don't need to rush.
All right, no worries. All right, great. So when we send claims off, we send them at the top of every minute for most payers. The only payer that's the exception is Medicare claims. Medicare is every other minute. So now what we're taking a look at are going to be some things that came back from the payer. And we're going to take a look at the electronic remits. We're going to take a look at a rejected claim from the payer, and we're going to take a look at patient eligibility all throughout this next session. I'm going to pull up a rejected claim here. And I'm going to pull up this first one for this patient, Ethel Bates. Go ahead.
You clicked on the red box?
Yeah.
Okay,
so
good.
I click on, it says view claims.
Oh, okay.
So I'm going to click right here. Yeah.
Gotcha.
And I always like to make sure I for my clients, this is not the only time you'll see this. When you're ready to start service with ClaimMD, you will receive training. And we can do multiple sessions of this demo as well. So if you need to have more people on it, another group of people on it, we can definitely do another demo as well, okay?
Cool.
All right, so in taking a look at the claim, even the ones that come back from the payer, we handle them the exact same way, where we're going to highlight where the potential issue lies. If you take your mouse over what's highlighted, we're going to tell you what the issue is. Now, you'll know this issue came back from the payer a couple of different ways. The first way, by taking a glance at the claim, you'll see yellow highlighting. That lets you know it came back from the payer. Another way that you'll know is if you look at the message that pops up either when you take your mouse over what's highlighted or at the bottom of the screen. The message will begin with the payer name. That also lets you know that this particular issue came back from the payer. And the message continues on. It says ERA denial. Claim not covered by this payer contractor. You must send the claim to the correct payer contractor. So one thing ClaimMD we are going to do is we're going to highlight, anytime we get an error back, we're going to highlight where the potential issue lies. All right. Like with this one, it could be a couple different things, and I'm going to kind of go over them. Well, you'll see the payer name that's highlighted. So this could be a situation where maybe the patient changed insurances and didn't tell you before they presented, or your office before they presented. With our system, if this needed to go over to Aetna, Medicare, or anything like that, you absolutely can change that. You do not have to go back to the beginning to create a brand new claim. The same thing with the ID number. If there's some type of ID number mismatch, you can definitely change that. Or maybe for Bates, maybe this should say Bates third. You absolutely can change any of those here.
Okay.
Coming back out of that claim and coming back into it. Another thing that you could do with this particular claim, if you receive this message, you may want to reach out to the payer to verify patient benefits. Along the left-hand side, top right-hand corner of the claim, there's a other actions box, and there's an option here that says check eligibility. And this will take you, if you select that, it'll take you from our claim screen to the eligibility screen. And in doing so, it will put in all of the information from the claim, the provider, the payer, and the patient's information. When I click check eligibility, this will give you a real-time pull from the payer of the benefits. Now, just so you know, for my demo, this is not live data, nor is it complete. We give kind of just a quick overview of what type of things come back from the payers. Now, doing this from a claim, I'm going to go over this eligibility, kind of talk about what's here. So you'll see patient demographics. You'll see if they have active coverage, where they are, any type of deductible for family in-network, family out-of-network. Same thing for individual in and out-of-network. And again, like I said, for my demo, this is not complete. It doesn't have every specialty, but it has a couple things I talk about. This first specialty here that's listed is chiropractic. And in taking a look at this, you'll see if they have active coverage for the specialty. So if you're looking at behavioral health, it'll be under psychiatric, mental health. But you would see this here, it will show active coverage. Now, this information will only be as detailed as the payer provides. If the payer provides additional detail, letting you know how many visits are available, or is there a specific amount that they can that their insurance covers, you'll see all of that listed here. If there's different procedure codes that are covered, we'll have that listed here. We can give you back anything that the payer gives us. Okay. So you'll see additional information. If there's any co-insurance, co-payment, you pretty much almost always will see that. For in-network, out-of-network, what that would be. As we make our way through here, I'm going to take a look at this next one, emergency services. This is probably what a lot of insurances deliver. Okay.
We don't need that.
They deliver active coverage, co-insurance, co-payment. All right. Occasionally, you may run into a insurance that all they say is active coverage. Like down here for hospital, it says active coverage. It doesn't give any additional information. I go over those to kind of just emphasize this information will only be as good as the payer provides. We can deliver you back anything you want. However, It'll only be as good as the payer provides. Now, let me ask this question of you in using Open EMR. Do you have an eligibility portion in Open EMR that could connect with the clearinghouse?
You know what? That's one of the few things I don't know, but I can find out.
That's fine. Well, I wanted to. The reason why I bring that up because I wanted to let you know with ClaimMD we can connect via API, and you can if OpenEMR can send us the 270 file, we can give you back the answer right back into OpenEMR. Okay. So
Okay.
there's a lot of things we can do with software. Okay. And again, I'll send you over it's my vendor info email. It has all the API information, what you need to do to connect and different things like that. Okay.
I know we have it. We do have an API.
Okay.
So and we probably have eligibility.
Okay.
I know that that's very rare in behavioral health EHRs, but they're very common in medical. And we're actually using a medical EMR, so I assume it has it. But
It may have that capability.
the API, gosh darn it, it escapes me. I don't remember if there's an additional cost for that, or is it?
Okay. For us, no. So I'll say that there's no cost for us. We'll provide the documentation for you if you program your system connect with our API. Great. Okay. So there's no additional charge though for us.
We can do that.
From us.
Okay.
Okay. All right. So then that way you can actually do real-time eligibility in OpenEMR and create the eligibility file there. You'll send it over to us. We'll send these results right back into your system. Okay.
Okay.
I'm going to go ahead and close this. Now, this is verifying eligibility from a claim. You may want to verify patient eligibility before patient's even seen. Along the left-hand side here, there's an eligibility link. If you click eligibility,
Well,
it brings you right here to
all right.
I'm sorry, go ahead.
Just realized my screen is not that huge, so just pause for a second when you click something, because I could not even see your cursor move.
Okay, no problem.
Let me turn up.
All right, along the left-hand side, you see where it says eligibility? I'm taking my mouse over there.
Got it.
Along the claim menu along the left side? Okay.
Right, got it.
I'll click on eligibility. Brings you right here to the same screen where you can select your provider if you need. If you're under your group NPI, generally that's where people will stay. But if you have multiple groups, you can definitely select between those. Select the provider, select the payer, and type in the patient's information. I'm going to just bring up a patient really quickly. Hopefully for my demo, they have active coverage. And there we go. We have active coverage. Now, most eligibility checks take under 15 seconds. Okay. There are a couple payers that can take up to a minute. When I say a couple, less than 10. Okay.
Let me ask
That
this
can take up to a minute. Go ahead.
just a wild question. Eligibility. Can you verify Medicare or Medicaid?
Absolutely.
Okay. And
Yeah.
like the Oregon Health Plan or Washington State Health Plan, those kinds of things?
Yes. Okay. So yeah, you'll be able to do those. In fact, give me a couple minutes.
That's fine.
After I answer your ERA question, I'm going to dive right into some of the payers and how that process will work, so that way you can make sure everything can come through us. Okay.
All right.
So I'll jump into that in a few minutes. All right. So that is taking a look at claims, okay, and the claim process. One last thing I'm going to show with this particular claim is, let's say hypothetically you wanted to appeal a claim. Now, appeals are not done electronically. They're done via paper as of this moment in time. With our system, we can help put together an appeal packet to be able to send off to that payer. If you see this printer in this far right-hand corner,
Yes.
you can click that printer and you will have the ability to print the claim and print everything else you would need from the clearinghouse for an appeal. So you'll be able to print the claim. You can print the claim with the form, or if you actually have that CMS 1500 form in your office, we can print onto that as well. For my demo purpose, I'm going to print the claim with the form. You'll be able to print the claim history, which is going to show proof of timely filing and everything that's gone on with the claim. The EOB, which I'll talk about those in just a couple minutes. And then an appeal request. For every single claim, you'll see general appeal form. This is a form most payers will accept that will allow you to appeal a claim. However, if the payer has their own payer-specific form, you'll see those listed here as well. So for this United Healthcare claim, you see United Healthcare's form. Had this at Aetna, Cigna, you would see one of their forms. I'm going to select United's form. I'll create the PDF. And here we go. I have the claim with the form, the claim history, the EOB, and the appeal form. And we're going to take all the information from the claim and place it into the appeal form. All you have to do is complete the form. These are all fillable PDFs. Definitely feel free to complete those. Now, as of right now, these are done via paper. However, when I talked about pricing, I let you know electronic appeals are coming. Okay, March 1st is the date that we're going to be rolling out the first payer, and the first payer you'll be able to appeal claims with is going to be Medicare. We decided to jump right into the deep end with this, okay, and work with Medicare. All right, now the difference between what you're seeing here for to put together appeal packet and electronic appeal is this. You will see an attached documents button. As of right now, the attached document button will be at the top corner, top right. I'm taking my mouse around where it will be, okay, where you'll be able to attach documentation to the appeal. And then there'll be a submit button to allow it to be submitted over to the payer. We try to make this as simple a process as possible, but then we will send this over electronically to that payer. Medicare will be the first. Medicare's the first one up, and then we'll go from there. All right. But you'll be able to put together those appeal packets right here in our system.
Okay.
Going back to my managed claim screen. Now, the next thing I'm going to talk about is an alert. Alerts are things you need to be made aware of. This first alert is a response alert, and it says missing acknowledgement of receipt. And for any alert, we tell you what the alert means and what you need to do. Like for this alert. This, I'm going to summarize. I'm not going to read all of it, but what's there.
Right.
But this alert will pop up 3 days after a claim is sent. If we have not received that acknowledgement from the payer of the receipt, that's when we give you this alert. We're reaching out to the payer every 5 minutes for a status. So hopefully within those 3 days and us reaching out every 5 minutes, they give us that acknowledgement. But sometimes it happens that they do not acknowledge the claim within 3 days, and you'll see this alert. And when this alert pops up, I like to tell my clients, this is not a common alert. The biggest culprit of it is Blue Cross Blue Shield. Even for them, it probably happens once out of every between 1,000 to 1,500 claims per month. Excuse me, 1,000 to 1,500 claims. Once out of every 1,000 to 1,500 claims, you'll get this alert. So it's not something that happens often, but it is something that can happen. And we tell our clients, anytime you get this alert, reach out to the payer, make sure it's been received. Now, when you reach out, they're going to give you one of two answers. Either yes, the claim was received, or no, the claim was not. If you find out that the claim was received, great. There's a selected actions drop down in the top corner, and you can remove this alert.
Okay.
However, if you find out that the claims were not received, you can retransmit them right here from the screen.
Okay.
For my demo purpose, I'm going to select remove alert, and in doing so, a box is going to pop up with some quick noting options. I'm going to select this first option, verify payer has received. I'll select clear alert. It notes the claims for me. I go back to my managed claim screen. Now that alert is gone. So now I've talked about the claim. I've talked about pretty much the entire claim process, how the claims get into the system, how they get out, how you work through rejection, alerts, and appeals. I've talked about patient eligibility, how you can verify patient benefits from a claim, and then as a patient presents. I've also talked about how you can connect your OpenEMR to be able to have them do that as well. This last piece we're going to talk about are the electronic remits. Along the left-hand side, there's a link that says View ERA. I click on View ERA, and you'll see every single remit that comes back. All right, now, when you get these remits back, they will be broken up by payer and by NPI. Okay. Now I'm going to show you some reporting that may probably make your life a little easier. But with this, you'll see them broken up by payer and NPI. So in that way, you'll be able to see them. Okay. And when you pull one up, I'm going to pull up this first one, United Healthcare. I'll pull the full ERA. You'll be able to see this full remit that came back. Now, every single remit, doesn't matter if it's Aetna, Cigna, United Healthcare, Blue Cross. Every single remit that comes back will be in the Medicare format. All the adjustment codes will be in the same place. When it's paid to be in the same place, it just gives all of the remits a universal view. We also, if I needed to pull an individual patient's information out of here, like say I needed to pull Janet's information out of this remit, you'll have the capability to come here to select action. You can go to single patient on this remit, and you can just click on that patient to pull just their information out of this remit. So if you ever needed this for an audit, anything, you can absolutely pull it.
Okay.
I'm going to go ahead and close this. I'm going to go back to my View ERA screen.
Could I ask a question?
Sure.
Now, I don't mean to be disruptive. It's not a good place to stop. But you mentioned the word audit. I was talking with a volunteer on our board who's a former CFO and auditor for a large organization. And she's very interested in this process because she says the process of auditing is universal. So far, this thing looks like it has such a comprehensive database that an auditor could come in and look at all this, or train an accountant to make sure that everybody gets their money. Like she said, that's the biggest issue you're going to have is if there's errors or files not received or no proper alerts, you're going to find out that the numbers don't add up, and some providers are going to be going, you owe me, $5,000. Do you have auditor reports for this? Maybe somewhere in your presentation?
Give me just a moment. You see this one right here? It says reporting?
Yeah.
Give me just a moment. All right,
You've got all the time. Okay.
All right. So the last thing I want to show here, I just want to show this really quickly. Our system will provide the 835 file. This is the file that OpenEMR is going to need. So in that way, everything can auto-post to the patient's accounts. Okay, you'll download. If you have the API, you'll be able to program your API to be able to pull that 835. Okay.
Okay.
And then automatically pull that 835, and so that everything auto posts in to OpenEMR for the patient. So then that way you can do your patient statements in OpenEMR and everything like that. Okay.
All right.
Now we also provide this in the CSV file. Now some of our clients, it sounds like you're probably a little bit bigger than this. Some of our clients use those for QuickBooks, and that's a file that QuickBooks will be able to read. So then that way they can help keep track of their payments there as well. Okay.
You mean each provider could do that, or the main billing hub?
The main billing hub. Let me say that the main billing hub would be able to do that. All right. So now let's go ahead and talk a little. So that's ERAs. ERAs are here's where they are. This is how you can get them out. Download the 835 or automatically. They're pretty cut and dry. Let's talk a little bit about reporting, because I want to answer that question now for you. On the left hand side, there's a link that says reporting. So now these are the reports that we would have for you. Now we have all the raw data that you're going to need. Now some of the report, let's pull them. So we have a few reports. We have bill charges by payer, provider, facility, procedure. Those are the first reports that come up. Probably the one that may be the most beneficial for you with this, you'll be able to see, let's say you can see what they billed. What each provider billed. You can do it for multiple time frames. I can generate this report, and you'll be able to see them. Now, for my demo, I only have one provider, so actually, let me go out of here, and I'm going to pull my bill charges by payer, just so I can, because I have multiple payers. So it'll be broken up by each individual. I'll just say provider, even though we're looking at payer, but provider. Hopefully you get that. And then you can pull up each piece. Like if I want to pull my Aetna piece, I know what was billed, and I can click on each piece and see every individual claim.
And you said you could do this by provider and the entire network?
Yes, you could do this by provider as well. So if I wanted to look at bill charges by provider, I absolutely could. I could be renewing provider or billing provider. I can do it by facility. Again, for my demo though, I have one facility. So that's the only reason why I look at. Now I can also do it by procedure code. Okay. But it will be broken down each individual piece. Okay. Now, also, there's a few other reports as well, so you can break those down these reports down. You can also download all this raw data via Excel. Okay, so you can download CSV file. If I can download just this data if I want, I can download the CSV. Or if I want to download all the raw data, I absolutely can. All of these reports are exportable through a CSV file. Okay?
Okay.
All right. Then there's a few other reports as well. Payer modified CPT code, top projections, claim corrections, age of billing, payments and adjustments.
And
Now,
you can do that for
what?
individuals or do you have permissioning in this where you can give permission to a facility to run certain aspects of this?
Okay, so let me show you the permissions that we can give, okay? All right, so along the left-hand side, there's a link that says Manage Users. So with any user, you can give permissions, okay? So you can give them permissions to access the claims portion, reports portion, but it's not going to break it down on a facility basis. So if you give a facility access to reports, they're going to be able to see everything for all facilities. Now, let me say this.
Yeah, I was going to say, wow, because in this field in behavioral health, there's 250,000 providers out there who are still not on an EHR, full practice management system, and their biggest fear is everybody looking at their data. So, if you had, that would probably be the one objection that would be hard for me to overcome, which is I want to be able to look at my data because I feel more comfortable, but I don't want anybody looking at my practice. So, anyway.
Absolutely. So I'm going to say this. That is not something that we have built in because that's generally, if you want to be able to have your data separate, everybody has their own separate account. That's normally how that would work. If as a organization you have an account to use with us, then that organization is the one who's managing that account and then giving permissions to people to be able to access different portions. If you're billing on their behalf and whatnot there. So that's kind of, I understand where you're coming from with that. I truly do.
Yeah, I don't necessarily need giving permissions to people to run the system, but to actually audit those parts, just look at data, not necessarily change data. And that doesn't seem too unreasonable to let providers to have access rather than have to get on the frickin' phone and call someone and say, let's set up a Zoom meeting and show me my data. I got some questions about how my practice is doing.
Okay, so I'll say this: what for that particular issue? What some other this is my first rodeo with what you're trying to do. What some of my other ones have done is they've set up a system so then that way they email reports to their clients.
I'm sorry, say that?
They email the reports. They email reports to their individual doctors, maybe on a weekly basis. This is why everything that's come through us.
It's an automatic system?
That's something that they set up on their end. This is not something ClaimMD does at all. But that is one way that some of them have handled situations similar, when they wanted their providers to be able to have access to have reports about what they've done. So then that way they can be able to match up with their particular system. Right. So they can see their data. So they'll pull up a report. I'm just going to put bill charges by payer or whatever report you want to run. I'm going to do bill charge by payer because it has multiple. So say this is John Smith. You pull up John Smith, hit this export, claim list, and then send that information over. So that way they have their data. But you can export all of this back through API, and people have parsed data, created databases with this data. Again, we're pretty, we've worked with a lot of different things. So they'll be able to pull this data back through an API and then have their software create a file to be able to send it over. So I've had some larger organizations, that's exactly how they handle it. We have larger organizations who use us and they send reports out to their clients. What I can do though for you is I think I have a client who does that may be willing to have that conversation with you. Okay. So
So my sense of this is, let me just guess, part of the way you guys get paid is the payers also pay you to process their claims. And,
Absolutely.
And so I have a question, or I have a question suggestion, especially since you said it wasn't your first rodeo on this. But in the behavioral health space, you're dealing with a lot of independent cowpokes. They're strong. They're ruggedly independent, and they're willing to participate in networks and contracts with groups, and they may even be willing to turn over billing to someone else if you can make the argument that it's cheaper, better, faster, fewer errors, and it's transparent. If it's not transparent, you're going to have people holding back until they find out. A lot of other people are saying, oh, it's no problem. They're individually not going to investigate like I am and sitting here going, okay, I follow this. But if you're wanting to grow networks nationally, which is part of what our model is being built around, you have to give some level of transparency to 50,000 independent practice professionals who are really using EMRs that are kind of monkey business EMRs that are creating a dependency on the EHR provider to deal with all the errors they're generating. And so they enter into a relationship in which they become inseparable from the EHR and have this sense that they need their technical support and professional staff in order to function. And in reality, they really don't need all that to have a safe, accountable product. And so they're actually even afraid to leave an EHR that's really quite bad in its design, and its the UI and the UX is awful. They have to learn it. And they're on the phone and submitting help tickets that they don't get answers to. So there's a huge number of people out there trapped in all these legacy systems. Mm-hmm. And I'm sitting here going, well, if there's transparency in this at any level where they can actually see information that makes sense to them, it's a no-brainer decision, because their paranoia, which is instilled through their current provider, goes away. And then you have this thing called onboarding, which I think is phenomenal. Electronic onboarding.
Right.
I'm like, wow, all right, no more having to fill out a paper form and fax it to somebody to get all these people onboarded. Okay, so I just wanted to put that there when you say your clients. I'm sitting here going, well, am I your client? What can you do? What can you do for my group? Trying to capture a lot of people right now who need systems like these built for the future, and a lot of people who are in agony with what they're using right now. If you want to look at one worst, go look at care paths. 10
yes, I'll say this: our biggest client base is behavioral health. Why? Because there's probably more of them than everybody else. Our biggest client base is behavioral health, and you're absolutely correct in what you're saying. They will stay with a horrible system. And when you say care paths, I just chuckle because I've heard horror stories about them. There's a few others as well that I've heard some horror stories about. But the clients, they're so used to having to jump through 47 hoops to get something accomplished. They think that's normal now. And now that so when they find something a little bit easier for them, they're like, they may freeze up because this is outside of what they're used to. Every software is not as difficult as the one that you're dealing with, or is hard to use. So when they use simple, it definitely takes a little bit of talking to be able to try to help
Right.
work through. No, I definitely understand exactly where you're coming from with that.
but,
So
yeah.
one thing I want to say this real quick. Oh, I'm sorry. Go ahead. I'll let you go first. And then.
Yeah, I'm actually trying to figure out what part of the country you were raised in, because you're really a fast-thinking guy. We don't have the resources to do onesie twosies with onboarding people and
Right.
overcoming their objections.
Right.
We're gonna have to figure something out. Either you and I, or we're gonna have to figure something out where you can say, look, you can see exactly what's happening in your practice, right?
Okay, so
and they go, oh,
let
really?
me say this.
Yeah.
I'm sorry. I didn't mean to cut you off, but a point just came up, and I just want to I want to kind of let you know what I'm going to do right now. I'm shooting over email. Shooting over email as we're talking. It's to my CTO. Because I know that's something we've done it for some hospital groups, okay, where we've given permissions. Now there probably be some type of cost associated with that. That's why I want to talk to them about that. Like, hey, how can we possibly do this for this particular new group that wants to be able to come over? It's not a This is not a standard feature. All right, so
Well,
if you could give me probably end of the day.
Oh, there's no
I
rush.
should be able to have an answer.
There's no rush on that. It's just don't do an Epic on us, because if you want to do if you call Epic on the phone and you talk to their CTO, the first thing they say is $10,000.
Oh no.
And you
No,
say
no,
$10,000 for what? And you say, well, we don't know. It could be $10,000 a month or $10,000 a week, but it's always $10,000 is their answer, and that's Epic, you know. And
All
then,
right.
so anyhow,
All right. I'll look into that. I will look into that for you, because I know as you were talking, I was like, we've done it. We've done it. That's the reason I was like, oh, we've done
it doesn't
that before,
even
but
have to be that big a deal. It just has to
Right.
be. Can somebody look and see? I mean, this is basic psychology, man. That people, people who know people, people who trust people, trust the opinions of people. And if you're trying to get a group of people who all trust an EMR provider that is working with a claims outfit like yours, rather than something a lot funkier, and seemingly cheaper, but not really in terms of the amount of time you have to put into it. They need something they can see that they can get at until they look at it and say, okay, I can monitor what's going on, and I feel comfortable with that. Everything's going the way it should, and I don't have to call the billing hub and get somebody on the phone who can call them back and see what their anxiety is about on a payment. And you're saying, okay, look, here we've got an alert, we're taking care of it, right?
Right.
And they have a lot of horror stories, like, you do a batch file, and you load up a file, and then all of a sudden, the other side, you don't get paid for that one file, and I
Right.
see you have a way to tell that it's been acknowledged and there's an alert within a day, but sometimes it can go for a week for some people. And
Absolutely.
you go, where'd the $20,000 go? And you call, and they say, well, we don't have the file. And you say, hey, the file was sent, it's time stamped, you got it. Well, we don't see it. And then, after 3 phone calls of, wait, we've sent it, we know we did it, they get technical support on the line, and they go, oh yeah, okay, we can see it now, right? That's the kind of stuff that terrifies people when they hear things like that, and that spreads faster than you can put your pants on in the morning. And so we need to be able, with a lot of these folks, to say that can't happen, and here's what you can do to look.
Right. I get exactly where you're coming from. So, and in our system, I'm just going to kind of go down this real quick. You'll be able to see when they upload the files, who the user is as well. So we've done something similar to this, okay, where we've allowed permissions for and we broke it down by NPI. I believe we broke it down by NPI last time. But I think we can break it down by tax ID too if we need to. But yeah, and each user, each practice got their own. Each tax ID got their own login, and they can see everything for that tax ID. If it was a multi,
that's it. I think that's it. I think the fact that you mean I just don't have to sit here. 'Cause there's a difference between people who are employed and people who are contracted, and you have that same problem with physicians and everyone else. They're like, I'm not paid a salary here, so I get paid no matter what. If they're saying I'm contracting and I'm trusting you to do my billing, I need to see, right?
Oh, absolutely.
Because don't. That could be $5,000 that just got lost.
Oh, absolutely. I understand that as we're talking, I'm coming up with a few other things as well. I know we're coming to the top of the hour, but I want to show the onboarding process really quickly. I just want to kind of give you a quick glimpse into this.
Yes.
On the left-hand side, there's a link that says PROV enrollment. Now, this isn't credentialing or anything like that. You'll see the NPIs that are listed here. You'll click on the one you want to enroll under. For my demo, I got a little click happy in my group, so I'm gonna click on my individual just for this morning. Okay, I have to clear it out after my last demo. So, in taking a look here, this first screen, you'll see what is the most common 20 to 30 for that particular provider's state. Okay.
Right.
Now, in taking a look at this though, you'll be able to search for payers. So I'm going to pull up just a couple quick ones. You said Washington.
Oregon Health Plan.
Okay, Oregon Health Plan. All right, is that All Care or is that LifeWise Oregon? Which one is that?
It's not. It's the state of Oregon. So.
Okay, so is it the Medicare? Is it the Medicaid?
Yes.
State Medicaid?
Yes.
Okay. Oregon Medicaid. All right, there we go. So, for enrollment, so when you pull up a payer, you'll see the columns. You'll see 1,500 claims, ERAs, and eligibility. If you have somebody doing UBs, you'll see UBs as well. But generally 1,500 ERAs and eligibility. If it says enrollment required, that lets you know something has to be done to be able to enroll. If you click enrollment required, if it's a form, we're going to provide you the form.
Okay.
Anything you have to fill out will be in this. I know this one's orangish color. Normally it's pink. For this one, it's orangish because of the yellow background. But anything that's required, you'll see this pinkish color. Okay. Make sure it's tight. You type in, complete that. Anytime there's a form, also there's a signature required. Okay. So with our system, you can actually sign right here on this. If you have a touch screen or use the mouse, you can apply a signature there. And if this needs to come from the provider, you can email this form to the provider and have them complete it. But once the form's done, there's a submit document. You can click submit document, and this will send that form electronically over to that payer.
And you can email this form with the active submit?
Yeah. You will email the form. When you email the form, all they will get is a DocuSign, if you will.
Right.
So you're familiar with DocuSign.
Yes.
So they'll get DocuSign where you'll send this to that doctor, and then they will just complete the form.
And
they'll sign it
and hit submit. Okay, got it.
That's it. That's their process. We make this easy. Okay.
Right.
So if it's a form, we give you the form. We fill the form out for you. All you have to do is complete the form. If it's a website, occasionally you'll run into a payer that's a website enrollment. I'll pull up Humana because I know it's their website. You'll get the website and you'll get instructions. Okay. So we give you the website. Now, even with this one, we give you screenshots. Okay. So we try not to make this hard. So if it's a website, we give you website instructions. If it's a form, we give you the form out, we fill it out for you. If it's, occasionally you'll run into something where it says quick enroll, like for Cigna. For ERAs, it says quick enroll. Quick enroll works like this. Click the button, click OK, you're done. That's the end of your process.
Okay.
That's all you have to do.
Okay.
Same thing. Now, most eligibility say quick enroll.
What's Blue Cross?
Okay, so that'd be, is that Regents?
Regents. Yep.
Okay. Okay, Oregon Blue Cross Blue Shield. Great, there we go. Quick enroll, quick enroll.
Wow.
This,
Moda?
That's it.
I got to see this. I got to tell people today what happened. Type in Moda. Yeah.
It says enrollment required. So if it's,
Okay.
and it's a form.
Okay.
Again, we give you the form. We fill it out for you.
Okay. One,
Right.
one, one last
Okay.
one. These are the three biggest
Nope.
in our state.
Okay.
Pacific Source. One word. I think it's one word.
All right. I'm going to do Pacific Source Administrators. This one right here,
No,
or Community
health
Solutions.
plans.
Or health plans. Health plans. Okay, great. So Pacific Source Health Plans. No enrollment required. ERAs. It says enrollment required. When I click here, it's a form. Here's the form.
Okay. Okay.
We get the form out. Now this one is asking for. Now some forms will ask for the EFT information, even if they're already receiving direct deposit. They're going to ask for that again. So I want to make sure you're aware that sometimes you'll see forms, especially on. I think normally I say for some of the blues, but for Oregon it's a quick enroll. But for some payers, no matter what, you got to refill out that EFT information. Okay, so just
Okay.
make sure your clients are aware. This isn't. We're not going to mess anything up. We have to have this. Okay, when you do those enrollments, and so occasionally you may have to attach additional documentation, like this one saying attach pages. So there's probably something here that has to be attached. Okay, yes, it says upload this form and a copy of a voided check. So you can attach documentation, attach the copy of the voided check,
Right.
and then this can be submitted electronically. Again, we don't make this hard. We
Got
make
it.
this simple.
Got it.
All
I
right.
got it.
All right. So that's everything with my enrollment. I wanted to make sure I showed you that, and then I've already talked through pricing, so that's taken care of. Here's what I'm going to do. I'm going to send you over a couple of emails. I'm going to send you one with pricing, so that way you always have that. All right. The second one I'm going to send is the vendor information. Okay. So
Right.
that way you can see the API information and things with that. I've already sent that email off to my CTO. Like, hey, let's have this conversation. Okay. About multiple permissions for multiple users, and being
now-
able to help parse the data
Right.
accordingly.
And we're not talking about giving anybody control over anything that would cause a problem. We're only giving them views. Okay.
Okay, I can say that. So that's the conversation we're going to have. That's the conversation we're going to have, and then we can follow up. We can follow up sometime. I'll shoot you an email. And we'll go from there.
Okay.
All right.
Are you working with? Do you have any accounts with an open EMR provider?
Yes, I have a couple
We-
that I know of, probably in the past, and I could, I talk to a lot of clients on a daily basis. I know throughout the past 2 weeks, I know I have open EMR clients, so I know they work with us. I hear about them. I've been hearing about them a lot more, probably recently. When I say recently, maybe the last 6 months, than I have even before then.
Well, they just released in December